we will talk about anticoagulants and bleeding and clotting disorders. What are anticoagulants? These are the substances which prevent the formation of blood clot when these are mixed with blood in appropriate proportion. Okay, so they can be studied under two headings. First are the natural anticoagulants, another categories of the synthetic anticoagulants. Heparin, it is a very powerful anticoagulant, first isolated from liver. How does it work? We had discussed the mechanism of action of heparin in the previous video. It inhibits the formation of thrombin. So prevents the conversion of prothrombin to thrombin, which is involved in the coagulation cascade. Next is protein C, protein S, then antithrombin 3, hirudin. It is isolated from the salivary gland of leech, and anophyllin. It is present in the mosquitoes, especially Anopheles mosquitoes. So it has got its name from its origin. Next categories of the synthetic anticoagulants. First one are the coumarin derivatives, that includes warfarin, dicumarol. Basically, they act by inhibition of enzyme vitamin K epoxide reductase. Okay, so the oxidized vitamin K, it is inactive. It is activated to its reduced form with the help of vitamin K epoxide reductase enzyme. Okay. Then EDTA. What is the full form of EDTA? Ethylene diamine tetraacetic acid. Then there are oxalates, citrates, sodium, fluoride. So what is the use of these anticoagulants? They can be given in certain conditions like for the treatment of myocardial infarction, stroke, in case of lead poisoning, atherosclerosis, angina, or it can be used in our labs also for the estimation of hemoglobin, PCV, ESR, etc. We shall talk about fibrinolysis also. There is presence of fibrinolytic system or anti-clotting pathways, reverse of clotting pathway, protein C pathway and prekallikrein pathway. They serve as fibrinolytic systems. Now, what is the significance of these pathways? Why do we need them? For the maintenance of vascular patency, first and foremost. Because normally, some fibrin is continuously formed and deposited in a form of a very thin layer on the vascular endothelium. But this fibrinolytic system, it continuously prevents it, and an equilibrium is maintained between coagulation cascade and the fibrinolytic system. Next function is to control the inflammation. It also clears minute blood clots in the small blood vessels. As we talked, fibrinolytic drugs, they can be used in the treatment of heart attacks to dissolve the clots or dissolve the thrombus in the coronary artery. Can be given in stroke and in case of pulmonary embolism. Now you can see this